everyone. Thanks for joining. We're going to get started now. 30 minutes, one question, one follow-up, and please join the queue if you have any questions. We have Dr. Yaffe here today, so I'll turn it over to her for some brief remarks.
Okay, thank you. Good afternoon. I hope that everybody was able to enjoy their weekend. Before I get into my remarks with respect to COVID-19, I wanted to take this opportunity to speak a little bit about the extreme hot weather that we are experiencing. We all know that hot weather can put your health at risk. Heat-related illnesses include heat stroke, heat exhaustion, heat fainting, heat rash, and muscle cramps. In this time of extreme heat, please drink plenty of cool water, even before you feel thirsty. Go to an air-conditioned place if you are able to do so. Avoid the sun and stay in the shade or use an umbrella. Reschedule or plan your outdoor exercise during the cooler part of the day. Take cool showers or baths or use cool, wet towels to cool down. And try not to leave a person or certainly a pet inside your parked car. It is also important to check in on your loved ones, your neighbors, especially isolated older adults who are living alone, to make sure that they're okay. You can visit in person if they're part of your social circle, or you can check in by calling, texting, or video chatting. With respect to COVID-19, I know that Mondays are typically when the government announces which public health units are able to move to Stage 3. I know that residents of Peel, Toronto, and Windsor Essex are eager to know when they can move to the next stage. We will be speaking with the local medical officers of health and looking at the data again tomorrow before finalizing our recommendations. Given the recent fluctuation in our case numbers, some localized outbreaks, and the higher risk nature of businesses and activities involved in Stage 3 reopening, we would like to be extra cautious about assessing the movement of the final 3 health units into Stage 3. On Friday and over the weekend, in Ontario, we had reported 195 new cases on Friday, 138 new cases on Saturday, and 137 new cases on Sunday. Today, we're reporting 119 new cases, bringing our total to 38,799 cases. Over the last several days, the cases have been primarily concentrated in Toronto, Peel, Ottawa, and Windsor Essex. As was discussed last week, many of the new cases in Ottawa are related to multiple large indoor social gatherings. And just this past weekend, there were news reports of a large party at a home in Brampton. I know these past few months have not been easy for any of us. Everyone has had to make sacrifices, big and small, as we navigate our way through this unprecedented time. I know we all want to see our friends and get back to having large gatherings, but we cannot do that just yet. Your continued vigilance and collective efforts to protect yourselves and loved ones from COVID-19 is central to our ability to control the spread of this infection. We are not out of the woods yet, and our response to COVID-19 continues to require a common commitment to follow public health advice. Following that advice now will directly impact what kinds of interactions we can have with our friends and family in the future. So please continue to act responsibly and respectfully to keep family, friends, colleagues, and neighbors safe. I will now turn it over to the media for questions. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question.
Question will be from Rob Ferguson at the Toronto Star.
Hi, Dr. Yaffe. I'm just wondering, because anyone who was at this Brampton party Saturday night probably won't be showing symptoms by Tuesday night when you make your decision, how do you factor the risk of this into the decision on Wednesday, whether Peel or Toronto or Windsor Essex should go to Stage 3?
Well, I think it is part of the considerations for sure, but we're looking at the bigger picture mostly in terms of the trends. 200 people is a lot of people, but it's a small percentage of the entire population. So, yes, it's one of the inputs into the decision.
Follow up?
Yeah, and on this, Windsor continues to have problems with the farm worker outbreaks. Are you considering leaving Kingsville and Leamington behind again?
Well, I think that is one of the options. We're working very closely with the health unit in Windsor Essex with respect to their outbreaks and prevention and control thereof. So we have to look at the distribution of the outbreaks and the trends in terms of deciding which parts, if the whole health unit or parts of the health unit can move forward.
Next question.
Next question is from John McGrath at TVO.
Good afternoon, Doctor. I'm wondering, you mentioned the cases in Ottawa linked to large social gatherings, and we've seen that people under 40 are a growing share of the number of the cases we've seen. But do we have any kind of provable evidence, I guess, for lack of a better word, that these are predominantly related to social gatherings? Because, of course, young people have also been the ones who have been called back to work as we've had more openings of things like restaurants and bars and other businesses. So I'm just wondering, is there some sense you have of, are young people growing in the number of cases because of maybe social irresponsibility, or is this about people going back to work?
That's actually a very good question. It's how we've been looking at the data as well. And originally it appeared that it was mostly people in their 20s that were getting infected at private parties, but it turns out it's not just young people. We've had people in their 50s who had private parties at their cottage, for example, even while they were symptomatic. So it isn't just young people. It seems to be people across the span of age who are not taking public health measures as seriously as they have been, and unfortunately getting infected and spreading the infection. Whether it's in the workplace, that's always a possibility. There's a lot of public health and Ministry of Labor guidance around workplace infection prevention and control. We are basically going with the case and contact management information and investigation that we get from the local health department in terms of identifying the most likely source of infection. And Ottawa Public Health has determined the majority of the new cases, the increase in cases, has been to do with private parties.
Follow up?
In terms of the move, as I understand it, we're spending the summer transitioning away from the old IFA system to the new sort of data collection, but there was a hiccup, was that last week, I believe, about Peel Region reporting more cases than expected, or the number inflating slightly. I'm just wondering if you think that is a one-time occurrence, or should we expect to see more hiccups in the data as more PHUs are transitioned to the new data system?
Yes, we are transitioning from IFAS into a new system that's called Salesforce, I believe, for case and contact management for COVID-19. And it's being done in phases. It started with 4 health units, one of which was Peel, and over the next while into mid-late August, eventually all the health units will be on it. The hiccup, as you said, was hopefully a one-time thing. We can't predict. Everybody's working extremely hard to make sure all the systems are working. That one, as I understand it, had to do with the timing of the data coming through from the laboratory into the Ontario Lab Information System, or OLIS, and then the transfer from OLIS into the Salesforce. So one day the number of cases was underreported, and then the next day it included the previous day's numbers, so it looked like a huge number. And at least we could understand it. The system, everybody worked very hard to correct the issue as soon as it was identified. And, I think the good thing about working with Peel at the beginning, it's a large health unit, had a large number of cases, and they were able to identify a lot of issues quickly and correct them. And can I say there won't be any more hiccups? No, I cannot say that, but hopefully there'll be very few, and we'll be able to correct them as soon as we can.
Next question, and this will be the last question unless anyone else joins the line.
Next question is from Chris Ensing at CBC Windsor.
Hi there, Doctor. On Friday, Premier Ford said that we have a large Mennonite population that went into the farms to help out, speaking about Windsor Essex, and that there's a group of Mennonites that have also been infected. Are you able to elaborate on how widespread that outbreak might be in Windsor Essex with the Mennonite community and how Ontario Health is approaching that?
Yes, thank you. We are working very closely with Windsor Essex Public Health Unit and Ontario Health on testing on farms, and also in case and contact investigation in the communities that are affected. So yes, there have been some cases in some specific communities, and we are following up on those and working collaboratively with the community to ensure that cases are not in spreading it to others, and using appropriate prevention and infection control. It's a very infectious organism, and it can spread to any community, of course.
Follow up, this is the last question.
And earlier or last week, Dr. Williams had talked about the continuation of on-farm testing. Any idea of how many might be scheduled this week or next week? And is that the solution here when it comes to farm outbreaks?
I understand that the on-farm testing is scheduled to start again later this week in conversation with Dr. Dirk Heyer and Ontario Health. We've been working very hard with OMAFRA, the Ministry of Agriculture, Food and Rural Affairs, on a toolkit for farmers that will help explain how the testing works and what can possibly happen and how to prevent and control COVID-19. Testing is only one component, and of course it's a picture, it's a snapshot of what's happening that day that the tests are taken. So today you might be negative, and in a few days you might be positive. So it's certainly not the be-all and end-all. It's one important component. What's important here also is good infection prevention and control, screening when people first start working in the farm. If they're coming from another country, they're quarantined for 14 days, ensuring that they have not brought the infection with them. They should be screened every day when they start work. We should try and maintain social or physical distancing as much as possible, or wearing facial coverings, looking for signs and symptoms, reporting them right away to public health, getting them tested, getting them isolated, identifying contacts, all the basics of public health case and contact management in an outbreak. The housing that they're in, there may be too much crowding. There may not be the ability to social or physical distance themselves. So these are all issues. I know that we are working with the federal government on how to improve the health and safety of farm workers coming, particularly from other countries, and also locally.